it's a great honour to have this opportunity to go down memory lane, but also to bring it forward to the future, to look at the impact, thank you, of the wonderful Churchill Fellowship that I was awarded in 1981. And I was looking at aspects of sickle cell disease, which is an inherited blood disorder. If you want to know a lot more about it, I'd suggest you get onto this particular website, sicklecellsociety.org. But it mainly impacts people who've originated from parts of the world where you find falciparum malaria, sub-Saharan Africa, the Asian subcontinent, Mediterranean countries, etc., etc., etc. But there is a myth about sickle cell disease that still prevails, that it only affects black people. That is not the case. You can have blue-eyed, blonde-haired individuals with the condition. So just a few examples of the problems in young children to start with, the swollen hands and feet, that in significant number are the presenting symptom. This is one of the well-known fatal complications of the illness if it's not diagnosed at birth, which is where the spleen gets chock-a-block with blood. The blood sickle cells can't get out. And this child was literally dying. And I had the opportunity to see her as an adult in Jamaica because they saved her life with immediate blood transfusions. And her skin colour was actually the same as the skin colour of the person holding this child, to give you an idea of the severe anemia there. And in adulthood, the severe painful crises cause 90% of acute hospital admissions. Now, when I got interested in sickle cell disease in the early 70s, it was because of my own ignorance, and I was very fortunate as a community nurse tutor to meet up with Dr. Misha Brozovic, then a consultant haematologist at the Central Middlesex Hospital. And just to put it in a nutshell, it was a mess. That's all I can say about the lack of services for families affected by the condition, both medically and in terms of, from my point of view as a health visitor background, health promotion and support for affected families. And there was a whole host of issues that we identified, starting, for example, with my own lack of knowledge, and I won't go through this list, but as you're sort of going down, you'll see I've highlighted two in red. And that's because these were the two areas that I wished to explore further when I was awarded the Churchill Fellowship. Now, as you saw, I'm an 81 fellow. By 1979, Dr. Brozovic and I had set up this first information screening and genetic counselling centre in the UK, based in Willesden in Brent, which is in northwest London. So when I was awarded the fellowship, I had the opportunity of 9 weeks travel. I spent the first 5 weeks in the USA, and I visited all these cities where I was able to observe sickle cell centres in action, but also visit the voluntary sector. And I also, in Washington, D.C. and Atlanta, visited national agencies. In Washington, D.C., I just went down to Bethesda, to the National Institutes of Health, and in Atlanta, I went to the Center for Disease Control. Now, maybe I'm not the sort of person you should travel with, because you've probably seen what happened in a couple of cities at the same time that I was there, or certain countries. And literally down the road from where I was staying was the attempted assassination attempt on President Reagan. And I was in Jamaica in the laboratories where they had the radio on when we heard the very sad news of Bob Marley's death. And also still in Jamaica when his body obviously brought home, and he lay in state for a day, I think it was. And the Jamaican nurse I got very friendly with said, "Would you like to see Bob Marley?" I said, "Oh, I hear there's loads of crowds down there." She said, come on. She went in her uniform, spoke to a policeman, and said, "This lady's from England. Don't you think it'd be a pity if she went back and hadn't seen, what's going on?" And he went, "Shh." And he pulled up the marquee, and we just went under and just pretended we'd queued for hours and saw Bob Marley lying in state. As a result of the fellowship, it really impacted on me in terms of good practice that I was able to witness in the US of A and obviously in Jamaica, in terms of production of materials with Dr. Brozovic and the voluntary sector. This picture in the middle is the community radio station, Capital Radio, community programs. It was the first program on sickle cell over the radio. Information for families desperate for information, leaflets to educate everybody about the difference between the healthy status of being a carrier but at risk of having a child with the illness if your partner was also a carrier, versus the illness such as sickle cell anemia, and also addressing issues to do with the terrible painful crises. And I also eventually got a PhD based on studies in that area. Now, this is where I would like to argue that it wasn't me that had this impact, but our centre in Brent, being the first one of its kind, was quite influential in developing other centres up and down the country, utilising some of the lessons we had learned. And by 2000, the NHS plan actually provided funding for the very first time in respect to screening. This wasn't to do with the management of the condition, but absolutely vital to identify newborn babies and to bring in a universal screening in pregnancy. And this, if you see the title, From the Margins to the Mainstream, this was the 10th anniversary brochure of the programme. And there's no doubt that due to the leadership of both the chairman, the former chairman, the Archbishop of York, John Sentamu, and the director, a consultant in public health called Dr. Alison Streetley, by 2006, all babies in England were being offered, parents were offered screening of their newborn baby for this condition. Public outreach strategy was put into place, and all pregnant women up and down the country in England were offered screening. So I think it did have an impact, and it certainly had a personal impact on me. And preparing for this talk, I was digging out old photographs of that period, and look at the photograph on, do you see what I see? Twin Towers. And I didn't even realise I had that photograph. And so I would very much like to thank the Churchill Trust for such an opportunity. Thank you.